Andy Johnson, RTI Basics response to intervention. Any plan needs to be economical in terms of time and money, practical and pragmatic to implement, and it has to be effective. It has to actually work. Gosh darn it. RTI is an integrated assessment and intervention program. It's designed to provide immediate help to students who struggle to read, write, or do math. Provides that immediate help without them having to be formally identified for special education. They are identified for help based on how they respond to interventions, hence the term response to intervention. Consists of 3 tiers. Tier 1, the intervention takes place within the general education classroom and includes high-quality classroom instruction, screening, and group interventions. Let's look at each one of those. High-quality classroom instruction. That tells us what is taught, how much it is taught, how it's taught, and by whom it is taught. And these are all things that should be included in an effective reading curriculum. Screening is used to see if students are responding to the intervention in the general education classroom. Now, it consists of 3 parts: establishing the baseline, setting those goals or benchmarks, and monitoring progress. Let's look at each one of those. Establishing a baseline, that's students' current level of reading performance. Now, I would recommend that you keep it simple. You can use a maze to determine approximate reading level, instructional frustration, and independent. That's what I recommend. But there are differing ideas on this, and I recognize that, but keep it simple. Goals are where you'd like students to be at various places. Usually there are 3 or 4 benchmark goals. Now, in any normal population, you're going to have 50% above and 50% below. So it's unrealistically and statistically impossible to have all students reading at grade level, but they should be that's a goal to get them generally around that area. Monitoring. Tier 1. The screening shows students who are not making progress towards the established benchmark. Once they are in Tier 1, you should be monitoring progress, and I recommend every 2 weeks, and I'll show you some ideas. But progress monitoring needs to be simple, valid, and pragmatic, and it should be related to the 3 deficit areas: word identification, fluency, and comprehension, and we'll be looking at that. Now, the group intervention is in-class supplemental instruction. This is for Tier 1. It should happen during the day in a general education classroom. Now, I would recommend keeping it simple, variations of the 5 elements. More daily sustained reading at the independent level and below, daily writing activities, guided reading lessons that focus specifically on word identification and comprehension for small groups, any word work on word parts, letter sounds and patterns, and some fluency activities, and you'll see some of those in another video. If they're not making progress in Tier 1, then they go to Tier 2, which is targeted interventions. All right? It's a response to an intervention, not a response to low test scores. Keep that in mind. RTI calls for data-based decision-making throughout. So data needs to be collected at various points during the intervention and used to inform instruction. That is data-based decision-making. In reading, it should be related to the 3 deficit areas again: fluency, word identification, and comprehension. Now, most standardized test scores do not tell us anything about the cause of the reading difficulty. They do not provide data to make instructional decisions other than the student is struggling in reading, and we already knew that. Sometimes these complicated tests are based on a simplistic notion of reading as simply sounding out words instead of creating meaning with print. So Tier 2 needs to be based on diagnostic data of some sort. That means we need to establish the cause of a reading difficulty. And again, the 3 deficit areas: word identification, comprehension, and fluency. RTI calls for database decision-making, and the first decision is what kind of instruction is needed. One size does not fit all, so you can't assume we're just going to throw all students in the same type of intervention. I recommend an informal reading inventory or a qualitative reading inventory of some sort. That is the only way that you get at these three areas, as well as an approximate reading grade level. Tier 2 must be intense and targeted. Tier groups must meet a minimum of 3 days a week in order to have any sorts of impact. And I would recommend 20 minutes a day for younger students, no more than 50 minutes a day for older students. Now remember, I would rather have short, intense instruction than longer, unfocused instruction. Keep it short and briskly paced. You'll have more effect there. Tier 3, students not making adequate progress in Tier 2 should go to Tier 3, and it should be built upon Tier 2. More intense, more targeted instruction designed to meet the specific needs. And again, it should focus on word identification, comprehension, and or fluency, depending on what the problems are. Struggling readers are not all the same. Some may struggle with word identification and not comprehension or fluency. So it needs to be targeted specifically on the deficit area. And that's why some form of a diagnostic reading inventory, informal reading inventory, qualitative reading inventory is needed. If students are not making progress in Tier 3, then they're referred to comprehensive evaluations to assess their eligibility for special education. Tier 3 is not to be special education. However, if it is, the International Reading Association, now called International Literacy Association, recommends that literacy or reading specialists or coaches provide leadership in every aspect of RTI because they have the knowledge and background related to literacy and literacy learning. There must also be careful planning and continued communication with everyone as you are implementing this. Final thoughts. RTI plans for reading call for evidence-based pedagogy or research-based curriculum to be used in each tier. Now, this is much different than a specific program or method. A curriculum is a planned series of instruction. You should have research-based strategies within that. To be successful, any RTI plan must be economical, practical, and effective.